A jury examined 14 deaths, fentanyl doses 10 to 40 times standard ICU ranges, pharmacy alerts overridden, and a physician who ordered those doses and returned verdicts of not guilty on all counts. William Husel was an intensive care physician at Mount Carmel West in Columbus, Ohio. Between 2015 and 2018, he prescribed fentanyl in quantities that pharmacologists and ICU experts testified were without legitimate clinical purpose at the levels ordered. Nurses administered those doses because a doctor ordered them. Mount Carmel's medication system flagged some orders as unusually high and still released them. The hospital's internal review later identified a pattern across 35 patients, 14 of whom died. The hospital fired Husel, notified authorities, and negotiated settlements. The prosecution sought murder convictions. The jury, after hearing forensic testimony, dosing calculations, clinical histories, and competing medical judgments, found reasonable doubt. 14 families received that outcome. The doctor who wrote the prescriptions walked out of the courthouse. Mount Carmel West is operated by Trinity Health and functions as a typical mid-size American hospital. Attending physicians, charge nurses, bedside staff, pharmacists reviewing electronic orders, and protocols designed to catch dangerous errors before they reach patients. Husel had been on staff since 2013. Colleagues described him as confident, decisive, skilled at end-of-life conversations, traits valued in ICU practice, where the boundary between relieving suffering and hastening death is clinical judgment. The orders in question were stark, not subtle. Standard bolus fentanyl dosing for non-tolerant ICU patients commonly falls between 25 and 50 micrograms. His orders ranged from roughly 500 to 2,000 micrograms. Pharmacology witnesses explained that those magnitudes, absent extraordinary tolerance, risk respiratory arrest. Nurses executed orders, pharmacists approved overrides, electronic prompts warned clinicians, and were bypassed. The system's alerts were intended to be guardrails. They also permitted a licensed professional to override them. In practice, every link in that chain deferred to physician instruction. The patients received the doses. The patients in the reviewed cases were critically ill, often ventilated, many placed into palliative pathways after bleak prognosis. Husel's defense centered on that context. These were dying patients whose suffering he sought to relieve. Prosecutors countered that comfort care does not routinely require doses that clinically would extinguish respiration. Now, the most consequential detail, revealed in Mount Carmel's own internal review and the legal timeline, is that the hospital completed its internal investigation, identifying 35 suspicious cases, well before notifying the Ohio Medical Board. Hospital counsel reviewed those findings. Settlements were negotiated and paid by Trinity Health. Non-disclosure agreements accompanied several settlements. Some families signed releases before they knew criminal charges might follow, and before they learned of other affected families. That decision shaped subsequent legal options and public understanding. Nurses who administered the medications, who clicked through override prompts and prepared syringes at a doctor's written instruction, were investigated by the Ohio Board of Nursing, but were not criminally charged. Pharmacists who approved overrides were not prosecuted. The settlement process resolved civil claims without any admission of criminal conduct, and no criminal convictions followed. In April 2022, a jury acquitted Husel on 14 murder counts after 3 days of deliberation. His medical license had been voluntarily surrendered during proceedings and remains surrendered into 2025. He has not practiced since 2018. Mount Carmel West closed in 2020, citing the financial and reputational impact of the controversies and lawsuits. The campus was later sold, though Trinity Health continues other operations. Approximately $1.4 billion in settlements resolved many civil disputes tied to the internal findings, but those payments did not equate to criminal culpability under the law. No family received a criminal verdict. The outcome leaves an unresolved legal question. If a physician orders pharmacologically lethal doses, multiple patients die, and a jury still finds reasonable doubt, what exactly does the criminal statute ban in an ICU setting where clinical judgment, institutional culture, and system design intersect? The facts, dosages, approvals, deaths remain. The legal outcome is separate. Subscribe to Case Files TV for a detailed examination of how the system permitted those doses, how institutions manage internal reviews, and what families and clinicians can learn from the gaps exposed by this case.